and how.
I gave you the reason already.
What's the reason?
Maybe lifestyle is a threat.
That's layman. You're not the doctor. But anyway, we have in studio this morning Dr. Nyaga, the CEO of Jumuia Hospitals, and we also have with us Dr. Joseph Ndalila. And I will allow them to just say hello to us and tell us a little about themselves before we dive into the conversation.
Sure.
The Breakfast Table on Activate. Listen and leave.
Great. Good morning, Dr. Nick.
Good morning, Sharon.
Good to have you. Karibu sana.
Thank you. Thank you very much.
All right. You can just tell us a bit about yourself, why you do this, when you started doing it, before we dive into the conversation, if that's okay with you.
Thank you. Non-communicable diseases and conditions or lifestyle diseases and conditions, it's not new. It's long. I think it's just that the conversation was more on the communicable diseases, like malaria, which was killing a lot of people. But as those ones were dealt with, then the magnitude of the non-communicable, which had always been there, maybe not to the same extent, then started getting a voice and the need to address the impact that they have on the families, the impact they have on institutions, the impact they have even on the country, then became quite prominent, especially now starting to capture the statistics of the people in the hospitals. If you take, for instance, mental health, now the numbers look staggering. They were always high, maybe not as high as they are now, but now that they're being captured, I think people then started realizing that this is almost as a crisis. And of course, then the other non-communicable conditions, lifestyle then became an issue here. Initially, it was seen as an issue of the West, but it's caught up with us. And so it's just that it's come to the surface now and realize if something drastic is not done now, it's going to get to a point where the economy just cannot handle it.
All right.
Yes.
Thank you, Dr. Nick. Let's go to Dr. Joseph. Good morning. How are you, sir?
Good morning. Thank you so much. Maybe just to add to what Nick has said, I think NCDs or non-communicable diseases we take them into attention because of the chronic nature and the outcomes, maybe due to prolonged, maybe exposure, or someone having that condition for so long. These will scale from maybe an individual in terms of health all the way to maybe the livelihood of that person, the family, and maybe the effects that it will have to the community, the economy, and all that, because we spend a lot of money taking care of these issues. And then I was also thinking of the fact that, first of all, they are chronic, meaning that they leave patients with comorbidities. Comorbidities are maybe complications that we develop from having these conditions. And then some of the issues that we are discussing here do not have a clear exit strategy. So I think the reason why we're having this conversation is because a majority of these conditions can either be avoided using the lifestyle approaches, or maybe we can mitigate the progress to ensure that we slow down the progress to ensure we have better outcomes.
All right.
Yes.
Great. Thank you. And we'll be getting back to that. I had wanted us to start at Jumuia Hospital because Dr. Nick is the CEO of Jumuia Hospital. Maybe you can tell us a little about Jumuia and what you provide to the community.
Jumuia Hospitals, first of all, they are owned by NCCK, the National Council of Churches of Kenya, where we have two level 5 hospitals, the hospital in Huruma and the hospital in Kaimosi in Vihiga. And I think the uniqueness of that is, first, it is NCCK's entry into healthcare in terms of delivery, of providing the service. But NCCK has always been there in anything social involving people. NCCK has always been there. And of course, there are member churches that have run hospitals for ages. And this time, NCCK felt the need to enter into direct provision of health care. And therefore brought in those two hospitals. And that informs the location. For instance, the hospital in Huruma, which is new, where before was just a clinic dealing initially with TB in that area, which is very high in that area. And then HIV, when HIV was the main disease condition in society, and then progressing now to a hospital, just serving that community and providing, really where you expect, what we call the west of Uhuru Highway kind of healthcare services to the people of Mathare, because Huruma is in Mathare. So went in there to provide accessible and affordable healthcare. And that is what we have been doing. We've been there for the last 5 or so years. And we have seen the need. We've seen the need, very great need of people who have conditions, but they're not even the thought of that they can seek care, even going to Kenyatta, because from that side in Kenyatta is still very far. So these are people who need attention around, almost on the spot. And we see a lot of those kind of people, especially women and children. Children come, with conditions. You can see this child has not been seen since they started suffering. Because even getting them into a vehicle to take them across, it's at times you feel like it doesn't even enter the mind of the parents. The parents are so preoccupied with just survival that health doesn't come naturally the way it comes out to you. So, and of course, there are others. Huruma or Mathare is just one. For NCCK being a national organization, sees this need everywhere, but it tend to start somewhere. And so started with those two, with the intention of spreading, using whatever architecture, to reach the people wherever they are, whatever their status in life, that will be able to get them. And that is working well. We are actually seeing people from all over the country coming to either Kaimosi or coming to Huruma. So the response is there and has been very encouraging. The mobilization, just people creating awareness, is what we have been doing a lot in especially the last 3 years, using the churches. And the response has been very, 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 very encouraging.
Okay.
All right.
All right. Yeah, over to you, Dr. Joseph. What do you think sets Jumuia apart, maybe when it comes to service delivery and the quality of healthcare?
Thank you so much. In a very short response, it's a church-based facility or facilities, and we offer our healthcare on a humanitarian approach, in line also with the Christian faith teachings. And then apart from that, I think we do capacity building to our staff regularly to ensure that we have a staff who understand our patients in terms of where they come from, in terms of the socioeconomic backgrounds, the challenges they face. And I think to sum it up, I will say that from the point of interacting with the patients, maybe interacting with the doctors, the healthcare providers, exit and even follow-up, there has been prompt follow-up and working on patients in regards to that. Then apart from that, I will say that the feedback we receive from our patients is up to par.
All right.
Great. Thank you so much, Dr. Joseph. So let's get straight to the non-communicable diseases. What are some of when we say this, it might sound like a very big word to some people, and they might be wondering, which animal is this that you're calling non-communicable diseases? So what are some of the examples you can give us of non-communicable diseases?
Okay.
Yeah.
Thanks. There are many. Just a basic definition. Chronic, they are chronic in nature.
Okay.
Long with let me say long-standing. They span a long period of time. and then they are not transmissible. They
Okay.
are non-infectious.
All right.
Chronic and non-infectious. We have 4 main groups, although we have a very long list of drugs, diseases that can fall under this category. So I will say the 4 main, which are either you have a cardiovascular disease. Cardiovascular diseases are diseases of the heart and maybe the blood circulatory system. Then we have cancers. We have numerous types of cancers. Then we have diabetes and chronic pulmonary diseases. Chronic pulmonary diseases are diseases of the lungs and maybe the airway. Yes. So those are the 4 main categories of NCDs or non-communicable diseases. But as our CEO has said, there are so many other diseases that fall under this category, because we will also think of mental health issues. We will also talk of obesity, among others.
Okay.
Yes.
Does hypertension fall there?
Yes, it falls under cardiovascular disease. So when we
Okay.
talk about cardiovascular disease, there are so many conditions underneath, because we can have hypertension, we can have heart failure, for example, as a sequel or complication of hypertension. We can have chronic infections, not really infections. We can even have cancers of the heart. We can have there are multiple issues
All
under
right.
that. When we talk about cancer, we can talk about all types of cancer under that category. And then diabetes, we have different classifications of the same. So I just gave the main types.
All right.
Yes, but under that we have sub-types of issues.
And they have been on the rise, or let's just say the cases are now many. I don't know, you're the expert, you could tell us if there are many now than they were before, but the indication is that there are more now. What do you think has resulted to this? Why this growing concern?
I think the most important thing is that currently we are able to screen and document the cases. I'm not able to confirm that in the past, when we were not screening, there were no issues with cardiovascular issues, cancer, because when people maybe grow due to various exposures, we develop different types of comorbidities, like now for these chronic pulmonary diseases. But now you see with industrialization, urbanization and all that, we have much more exposure to hazards to our health, for example, pollution and all that, which can predispose us to this chronic, for example, pulmonary disease. We have cancer under that category. Also, we can talk about the sedentary lifestyle that has come with the urban lifestyle. For example, you just want to eat junk food. You have very little time to concentrate on your diet, and the outcome is you end up developing dyslipidemia, poor control of your glucose, poor control of your lipids, and then the outcome is you develop diabetes. So we have more risk factors currently than we had in the past. And we have more risk factors for example, in the urban settings than we have in the village or rural settings. Yes. So I think that would explain the rising trends.
All right. Would you talk of maybe these risk factors you're talking about?
Yes.
For diseases like diabetes, hypertension, heart disease.
Yes.
What are some of these risk factors that people should be aware of?
I think, thank you for that question. It's very important. I said sedentary lifestyle. For us people who work, for example, you work in an office, you wake up in the morning, go to work, you spend your time seated on your desk. Maybe you have a very small space, you cannot exercise, you are locked up in that space. So in between you're having meals. Okay, so you're having meals across the day. You are accumulating glucose. You're not burning it, or maybe you are burning with your brain. But I think, in the end, because you woke up, you did not exercise, you went to work, you've been very busy. Your brain is very busy, but then physically you are not fit. Then you accumulate you take a lot of calories. In the evening, you're very fatigued, tired, of course, and then we always look for fast food as solutions to hunger and all that.
Right.
So we end up eating what actually is not healthy. So I was saying healthy diets. I mean unhealthy diets. So we need to substitute that with a healthy diet, which is actually relative. We need experts to guide us on what we need for this. Then I wanted to say, so when we talk about sedentary lifestyle, it's a broad topic. Then I also wanted to mention something like family history. Yeah, family history is where maybe you come from a family where you are nuclear family, for example, your parents
Yes.
or your siblings, your cousins and all that. They have a history of having a certain condition, mostly prevalent with cancer. And then we also have chronic lung issues or airway issues like now asthma. So such people, for example, when you come from a family that has had such a history, there is a risk of developing or having that condition in your life. Then we have issues like now smoking, alcohol, or maybe drug abuse, because these things maybe when taken in certain proportions, they cause systemic changes in our body. They cause injuries. It's just like food. Nothing is harmless.
Too much of everything is poisonous.
Too much of
anything.
is actually it's and vice versa.
Yes.
Because everything is supposed to be taken in let me say there are
Moderation.
proportions in moderation,
Yes.
so that we have an equilibrium at which your body can work.
Right.
We need everything that God has provided for us to work with in equilibrium. At the
So
moment
not,
we
not
take
too
more,
low, not
yes,
too high.
not too low.
Except
Because
drugs.
for example,
Yeah, except drugs.
Except
yeah.
drugs.
for example, you need proteins
Yeah.
to make sure that your body, let me say, synthesizes the enzymes and all that enable your body to function. Yes, but if you take so much of proteins or so much of anything else, now you destabilize that equilibrium.
Okay.
If you take too little, you will also not have. So you end up having malnutrition. Malnutrition can be too much. Obesity is malnutrition, or too little. So being maybe, let me say, malnourished doesn't mean that someone is.
Healthy.
No, I meant being malnourished
Yeah. Or doesn't mean that
is on both
okay,
extremes.
On both
It's either
extrees.
you're
Okay.
obese,
Right.
or
On the other side.
yes,
Okay.
but also you could just be looking like you're good, but then there are aspects, chemical
Right.
aspects within your body that are not okay. Yes. Then there are other risk factors, environmental exposures, for example. Yes, these toxins we are inhaling, we are taking in water. These foods, nowadays we have GMO foods.
Yes.
And they are grown at a very fast speed, so that we solve the hunger situation, and for that reason we use a lot of chemicals, and these chemicals, some of them are carcinogenic, or they pose a risk of developing cancer, among other risk factors. Thank you. Maybe as we discuss, I'm sure that we'll be bringing on board several other issues that will include risk factors and mitigation measures, or maybe prevention.
All right. Just before we get to the risk, to the mitigation,
Yes.
Dr. Nick did mention that these diseases affect in one way or another the family, and maybe just even speaking from where you are and where you have been with the hospitals that you have, what have you seen? What effect have you seen on the family, Dr. Nick?
This NCDs, as I just was saying, they are chronic. They don't easily go away. And you've seen people come with a condition. Of course, the most talked about are cancers. And they are fairly well off, middle class. But when that condition starts, that family gets destroyed, because first, the person who is sick is unable to work. So it becomes unproductive.
Right.
Then the treatment takes so much money, it's so expensive, whether it is local or is abroad in India or wherever. The funds just go to medication and just sustaining the person. And people's attention, the family's attention, everybody in the family, then the attention is drawn on the sick person and how to get out of it. So whether you're talking about the spouse, whether you're talking about the brothers, sisters, the community, whether you're talking about the children, if they're in school, the attention is drawn away from their core purpose, which is studies, to just the suffering of the sick person. Businesses, you find even the attention, if they are business people, the attention to the business on the workers, if they are running businesses of whatever size, is drawn away to the person who is sick. And it doesn't take long. Actually, just one person with an NCD is enough to destroy a family's economic lifeline. And the more you have, the more people you have with those kind of conditions, the faster it destroys the economy. Because with our support system, if one person is sick, then you fundraise. So it starts sucking in the resources of the next of, not necessarily the next of kin, but the line of friends, of neighbors, if it's church, the church group. And so if it is not stemmed, it actually destroys the society economically, just by sucking in the resources. And I mean, from the numbers that the providers have been working on, I think there was a report that was published a couple of years ago now by Central Bank, just tracking the forex, the foreign exchange, applied for by people taking patients outside of the country, to India, to South Africa, and so forth. And they're talking of 15 billion shillings that time, 15 billion shillings per year. Now, when those funds are taken out of the economy, I mean, what 15 billion shillings, what it could have done 5 years ago, is a lot.
It's a lot, right?
Now and that is what now goes out. More than double, maybe 10 times is spent here and is not tracked, because the drugs, the equipment that are used to manage these conditions are also important. They are not made here. So the money doesn't circulate in the economy. It also actually goes out.
Yes.
So when you look at the quantum, it's huge amounts that would have gone to alternative needs in the country.
Right.
And a lot of times what is tracked, is where it says, you're going for treatment. There is more where people don't say they're going for treatment. They say they're going for tourism, they're visiting friends, but actually they are going for
treatment.
For treatment.
Yeah.
So it's a huge burden on the people. It's a huge burden on the families. It's a huge burden on the society. It's a huge burden on the country.
Right.
Huge.
All right.
Right.
Thank you for that. And so, Dr. Joseph, you just mentioned that these diseases can be either avoided or managed along the way. Let's talk about the management. The avoidance, is doing away with the risks. Taking care of the risks, right? So, how do you deal with the management of the diseases?
Okay, thank you. Now, you see, when we talk about NCDs, is a whole vast number of diseases. So in this conversation, it will be very difficult for us to discuss the management per case.
Right.
But I can just say, I will use an example of maybe what we do when we interact with patients who have cancer or family history of cancer or at risk of developing cancer. For example, cervical cancer. So what we do is, like now at Jumuia Hospital, what we do is we offer screening for our patients. And the first step is not actually to screen, is actually to do sensitization. So after doing sensitization, it means people are informed on what is needed to prevent or to treat or to manage the progress of this condition. And in that, when we have done sensitization, we ask people to come for screening investigations. And you see there is an initial screening, which is actually to see if there is anything. And if there is nothing, we tell these people, you need to be around maybe once in a year or once biannually to just check.
Okay.
Because you are at risk. For example, someone who has a family history of cervical cancer, people who have infections, there are different types of infections that pose risk for developing these issues. So we offer screening, and then we refer these patients to places of care. Although, for example, for us, we also have specialists who offer surgical intervention, and when we need other modalities of management, like maybe chemotherapy, radiotherapy, That's why we exist in partnerships with other facilities, like now the national referral facilities and these other facilities that provide specialized oncological care. Now, I'm saying this because every condition will have its own management, but I'm very sure you will take note that at every point there is screening and then the initial management of progress.
Okay.
Because, for example, if we are talking about hypertension or cardiovascular disease, the initial step is to identify these people and then educate them, like let them know what they're suffering, and then enroll them to a clinic and then follow them up, so that at least on a regular basis our patients are updated on their progress, and then we are also updated on their progress. We are able to adjust their treatment, and we're also able to work with other providers to ensure that their health is optimized.
Great.
Now,
Just hold it, Dr.
Okay.
Joseph.
Thanks.
We need to take a business break, but we'll be back in a few. Keep it right here.
The Breakfast Table on Activate. Listen and leave.
Hope FM, another quality service from Christ, is the Answer Ministry.
The Business Line. It's just business.
The Kenya Wildlife Service has unveiled its strategic plan for 2024-2028, designed to lay a solid foundation and erect a scaffolding for a new phase of Kenya's wildlife protection and biodiversity conservation. The plan aims at amplifying Kenya's wildlife economy while strengthening partnerships between KWS and its stakeholders. Through the plan, KWS will implement various initiatives to enhance the socio-economic potential of wildlife conservation, create employment opportunities, improve livelihoods, and boost Kenya's foreign exchange earnings. Speaking at the launch of the plan, Tourism and Wildlife Cabinet Secretary Rebecca Miano noted that expanding wildlife economy is crucial in reducing inequalities, enhancing food security, and supporting local economies, particularly in rural areas.
They will be addressing strategic issues, including an untapped wildlife economy, declining numbers, participation by communities, among others, and even enhanced management and conservation of our biodiversity. I have encouraged them to ensure that they have implementation of the plan, and I have really appealed to them that the discipline and speed of execution will be what is a game changer. KWS have told us that today is a new beginning in their management of the affairs of the organization. We all know that documents are good, but if they are not executed, they remain documents in shelves.
And NCBA has acquired 2 hybrid electric vehicles from SFAO Mobility Kenya, and strengthening its commitment to environmental responsibility under its Change the Story initiative. The vehicles combine the functionality of an electric motor and gasoline engine, ensuring optimized performance while reducing environmental impact. The bank said the transition represents its leadership in green innovation and its continued efforts to foster a sustainable future for its organization and the community it serves. Isaac Owila, NCBA's acting group director for technology and operations, said by setting an example in the adoption of sustainable practices, the bank is not only meeting its operational objectives but also enhancing its brand reputation. That's business. Good morning, I'm Melissa Odor.
The Business Line. It's just business.
Listen and live on 93.3 FM in Nairobi, 93.9 Western Kenya, and 101.9 Mombasa.
The Breakfast Table on Activate. Listen and leave.
Absolutely. Just 11 minutes to the top of the hour. It is the 1st of October, the year 2024. We are on Breakfast Table. This is All Kenyan Tuesday, and we are talking about lifestyle or non-communicable diseases. And Dr. Joseph, you're talking about management of these conditions, and you're talking about early detection through screening, or having to do some examinations to tell the condition of the patient. Would you please continue a little bit on that?
Thank you so much. So as I had started, I said it depends with the condition of the patient. you see, it's very difficult for us to just come to you and tell you we want to do screening of this, or the initial step is sensitization. There are people who are not informed. And I think part of this conversation we are having here is to sensitize as many people as it is possible, so that people can take up the initiative to go to nearest facilities to do checkups for different issues. Just a wellness check, for example, can uncover a few issues, especially in relation to NCDs. Then
So,
when
Doc, you're saying, sorry to cut you short, you're saying
yes.
that on a regular basis, every individual should go for a wellness checkup. That's what you're saying.
Not regular.
Okay. How often?
Regular, I think, let me say once annually for a wellness check is okay.
Okay.
Yes, just a wellness checkup. You don't have to be sick. Yes, but you see, in that wellness checkup is when you can pick up some issues.
Okay.
You can be adding weight without knowing it's not healthy. You can have hypertension without knowing you are unwell. Because majority of our patients who have, for example, these cardiovascular diseases, we found them maybe when they have complications already. You find a hypertension, you think it's maybe having 3 months onset or maybe a few months onset. Then when you do a screening of the heart, you come to realize there are hypertensive changes, because maybe this patient has been having this condition for quite a long time. So I think a once annually wellness check is important. It will help us pick up these issues, and then once we've picked up an issue, we follow it individually. Yes.
All right. Keep on. I cut you short.
Yes. So I think now, after identifying the cases, is when we profile them and put them in the respective cohorts, for example, because I will not follow up a cancer patient in a cardiovascular department. So all these people, they fall in different categories, although management is multidisciplinary. Because, for example, if you have a cardiovascular issue, it can have complications all over within your body. So management is not actually in the medical outpatient clinic alone. It might require you to go through or to be seen by different specialties or specialists. So you might have several clinics. Anyway, before we get there, I just wanted to say that the most important aspect of management of these issues is lifestyle. So we teach our patients to do what they can do at home from the comfort of their homes, maybe wherever they are, to ensure that we slow down the progress. And part of it is exercise, healthy exercise. The most, universal exercise you can have is walking.
Okay.
Yes. Even when you're at work, I encourage people, go downstairs on the stairs, not the lift every other time. Do not sit in one place for so long. That is the most universal exercise. So, and then nutritional education, so that people can take up that. That's easier to do at home. Then for us, you leave us with the medical aspect. Then, as we do follow up, we ensure that we capacity build people, including even the family, because there might be a change of diet in that home, and people must support these patients.
Right.
Yes.
All right.
Yes, and I think I've just talked about maybe 1% or less of management, but I think those are the most important aspects. Then maybe when you go to management per case, there are details. Yes, which we can discuss on a different.
Maybe I can add something.
Sure, go ahead.
As a provider, a lot of the people that we see, for instance, in Jumuia, actually are conditions that, if we're intentional as a country, that we can reduce, so that then the focus is left on the conditions, like cancers, which are still not quite understood what the best way of mitigation. But there are those ones which we know. For instance, included in the non-communicable diseases and conditions or lifestyle are accidents. And we do a lot of, we do a lot of surgeries because of accident, road accidents, broken bones, fixing all that. And it's just because it's our lifestyle, it's our attitude on the road. And there are so many, and that takes a huge toll on our economy. Every hospital, if you go to government hospitals, the county hospitals, the surgical wards are full of people from accidents, whether it is motorcycles, or is pedestrians, or it is roads, just driving, you're told, keep to left. People want to overtake, they overspeed. Those are things that lifestyle, just being disciplined, can reduce significantly, and it has huge results. It releases a lot of resources if we did that. Domestic violence, again, we see a lot of those ones. Those are preventable. It's a matter of being, as a nation, being disciplined, being mindful of others. And you find it actually doesn't take a lot. It's just discipline, it's awareness, it's just people being responsive. Joseph is talking about exercise, walking. I mean,
Just walk.
just walking, coming from Valley Road here
To town.
to GPO.
Yeah.
Is basically is a kilometer.
Yeah.
But you find your people are taking matatus, going and coming back. So it's that kind of thing.
Yeah.
Now there are walkways, you can walk. This place doesn't rain much that you say, even if it does, then you take an umbrella.
Yeah.
When it comes to food, nutrition again it's the same thing. Spare a little bit of time and get some home cooked food. Because when you look at the foods, the problem is in the processing. Because when the food is processed, the only way of storing it mainly is adding salt. So salt then creates problems of its own when you take too much of it. Then you want food to be palatable. So you add sugar.
Yeah.
And you find in the food, sugar and salt are the main culprits. But if it is homemade food, surely, just sparing some 30 minutes.
Yeah.
Once in a while, yes, eat junk food, ready food, but not all the time.
Right.
But I think the tendency to have the easy way with your own life on the road, I think that is something that we need to discipline ourselves. And if we do, then we'll find ourselves with enough resources to deal with those conditions now of high blood pressure, of diabetes, except the ones which are related to the nutrition and exercise, issues of obesity. Now even children, 8-year-olds, obesity becomes a problem.
Right.
And with obesity, then comes issues of the joints, because then you put a lot of pressure on the joints, which are not meant to carry that kind of weight. And again, in Jumuia, we deal with a lot of those issues of joint replacements. Yeah. And you can see his lifestyle is preventable.
Right.
It's preventable. I think it's just creating awareness, making it an agenda for the nation, and then monitoring it and measuring it from a personal level to family level to community level.
Right.
Yeah.
Thank you.
Yeah.
Thank you. I love the way you put it because it's a beginning of the month.
Yeah.
We can make choices beginning today.
Yeah.
And live life better.
We can make resolutions.
Right? It's not too late.
Yeah.
It's never too late to begin anything great. Okay, so we have a few minutes to close it up, actually a minute or so to close it up. And so I'll start with you, Dr. Joseph. In your final remarks, I know we could go on and on, but time fails us. So what would be your final comments on our conversation today?
I think this conversation was good, and I think every person who is listening to us and everyone who will listen to you, if you can help us communicate to other people, is that first of all, when we grow, our problems just increase.
Yeah.
Dr. Billy Graham once said that the moment you are born, you started dying. Do not let it accelerate. So let's do wellness checkups, and then we do it routine, and then maybe when we are told that we need to follow up on these particular issues, as an individual and as a community or as Kenyans, we take the initiative to walk through and see that our healthcare is improved.
Right.
Thank you.
Thank you very much, Dr. Joseph. Dr. Nyaga, your closing remarks.
Again, I just say, let's attend to our health as early as possible. Early detection, early attention makes a lot of difference. You know, the Swahili say, "Sposhiba ufa, tajenga ukuta," and that is so real with the health. As parents, pay attention to your children, whatever age. It helps. Just pointing out if behavior needs to be managed at the family level, and they can educate the children. I would like to readdress the parents, because the carelessness on the road that causes a lot of these accidents is behavior that would have been changed at the formative stage, with children. The lifestyle of food, the smoking, which causes a lot of the what we are calling the chronic bronchitis, which is a major thing. That can be addressed. Eating habits, the diabetes and so forth. Again, that can be addressed at the family level. Exercise, the discipline of just getting up and taking up 2 kilometers, a kilometer going, a kilometer back before breakfast or something like that. Those kind of things, let's practice them at home.
All right.
Yes.
Thank you. Thank you, Dr. Nyaga. Time fails us, but we really appreciate the great work you are doing at Jumuia hospitals. May the good Lord continue to bless the work of your hands as you impact the communities around you.
Maybe they would want to give their number?
Yes, if there's a number, then we can get it. Or location, how we can get in touch.
A number for...
The hospitals?
The hospital.
Yeah.
Yes, we have a number for Jumuia in Huruma.
Okay.
And the number is 0720 884 432. That is 0720 884 432.
All right.
All right.
Thank you so much, and God bless you. That's our time, and our time is really much gone, so we have to leave you now. But we'll see you tomorrow, same time and same place. Have yourselves a lovely day. My name is Sharon Aitore Wangenye.
Favored Frank is my name. Bye-bye.
Hope